Hello and welcome to the Health on the Plains Coffee Hour. Starting today and continuing on the last Wednesday of the month through October, I will spend an hour with you all and with a cup of coffee, talking to some great leaders and thinkers that are working to support rural communities and rural health. Now, we know that this time doesn't work for everyone. So we will be recording this conversation. And if you're listening today and something really resonates with you, please share it with your colleagues. We'd love for them to learn from our great guests as well. My name is Wyatt Beckman. I'm a senior analyst and portfolio strategist at the Kansas Health Institute. And I am thrilled to host this new series. For those of you that don't know about us, the Kansas Health Institute is a nonprofit, nonpartisan educational organization based in Topeka. We believe that evidence-based information, objective analysis, and civil dialogue can inform and support effective policies, programs, and interventions for healthier communities. Now, this series is built on the idea that nuanced conversations with thoughtful people can help us better understand the many factors that shape rural health and rural communities. And with that better understanding, we can all work to envision and implement more effective strategies with and in our rural communities. And oftentimes, I find the best conversations are ones that are guided by a good question. So today, that question is this: how can we bridge rural health and economic development to help rural communities be healthier, more vibrant places to live? And here to talk about that question and all of its complexities is our guest, Bonita Robertson-Hardy. Bonita is a workforce and economic development professional committed to connecting the public sector, private sector, and nonprofit communities. Since joining the Aspen Institute Community Strategies Group in 2021, Bonita has worked to highlight the importance of equitable rural prosperity by lifting up the diverse voices of rural practitioners and researchers. A native of New Orleans, Bonita works to build relationships, influence policy, and advocate for equity and opportunity in public and private organizations. Bonita, thank you so much for joining us. We're thrilled to have you.
Thank you. I appreciate the opportunity to be here today.
So I have to start. Um, this is a coffee hour. We're gonna have a great conversation. My conversation is gonna be fueled by our office coffee. But how do you take your coffee, if at all? Are you a coffee person?
So I have a mug as well. I am not a coffee person. However, I am a tea drinker. So usually I take my tea with a little bit of honey and a little bit of lemon. And usually it's a black tea. But I appreciate all the coffee drinkers out there.
I can get behind a black tea with some lemon and honey. And I don't wanna get you in trouble, but I know you're a native of New Orleans. Chicory root. Are you in or are you out on chicory
I'm
root?
out. I'm out. I don't think my card of to New Orleans will be revoked, but I am not a chicory lover. I love all other things, but not chicory.
You
So
know, it's not for me either. I'm sorry, New Orleans folks, if you're here, please stick around. I promise it's only up from here. Um,
yes.
so let's dive in. So we've got our key question, and I think embedded in that question is underlying question of why. So,
Yeah.
but I want to back up. So as an organization, you all have launched a broader initiative called Thrive Rural. And
Mhm.
that initiative really imagines and tries to support that equitable rural prosperity that I mentioned in introducing you. And that's a place where across the US, rural communities and native nations are healthy places where each and every person belongs, lives with dignity, and thrives. And as part of that work, around this time last year, you released a report called Unlocking Potential: Collaborative Strategies for Rural Health and Economic Prosperity.
Yeah.
And it builds on the core idea that rural health and rural communities are inextricably connected. That's the language you used. Neither field can be successful without the other. So tell me more about that, because we're going to talk about principles, but Why are they
Yeah.
inextricably connected, and why should we be diving into this topic?
No, I mean, you are absolutely right. That's what we believe, and that's what the practitioners that we interviewed for that report really said. I want to take a step back, much like you did, Wyatt, and really give just a little bit of context about community strategies as a whole, because I think that's important to understand when putting the report in context of how we do our work. So CSG has been around since 1985. So we're celebrating our 40-year anniversary this year. And really, since the beginning, we've always worked to think about doing economic development differently. And for us, that means really taking an asset based approach to development. So, thinking about the assets that are within a community to start with, and not really thinking about deficits, but what does the community have? And we know that our rural communities and regions are so rich and have so many different assets, right? And so the framework itself, the Thrive Rural framework that you mentioned, was really part of a series of tools that CSG and strategies that CSG has been putting out since its inception that builds on the WealthWorks model of doing development and really looking at the eight capitals that are needed, right? And thinking about value chains, and then thinking about the Hubs report, which was published in 2019, really thinking about these organizations that are these hubs that are doing development differently within their rural communities and regions that have trust, that break silos, that have the ability to take risks, all these 12 characteristics that these hubs have. And the framework is the next iteration of that, another tool that really thinks about, okay, well, what do you need to really answer this question of what will it take for rural communities and regions to thrive and to succeed? What is needed? And so we gather practitioners and researchers from rural communities to really go through and help us build what will it take to answer that question. And so they came up with the Thrive Rural framework, which really thinks about the local level, what's needed at the local level, and what's needed at the systems level for success. And as a part of that, one of the building blocks, they came up with all these building blocks, and there's evidence behind every building block. And it's all on our website, aspencsg.org, if you want to dive into it. But as a part of that, the ultimate outcome, as you said, is creating these healthy, thriving communities where every person can belong, live with dignity. Health is an integral part of that. And we had support from the Robert Wood Johnson Foundation to do this, and they're a health funder, but also this understanding that health cannot be disconnected from development, right? They are, as you noted in our report, they are inextricably linked. And thriving communities really need healthy people. And people need strong economic and health systems to thrive as well. And so they are really integrated, and it's really necessary for both of them to be present, to have these thriving communities for all. And one last thing that I'll say on this point is really this idea as an example. We hear a lot about the closures of hospitals, right? Particularly in rural communities and regions. And this work all too well. And we know that maternal care is also an issue in our rural communities and regions, right? And we know that that is hindering the ability for some of our young people with young families to stay, who want to have families to stay in communities, and it's also a hindrance on attracting some younger people to communities. And so, what the data is showing us is that, what is it, 1/3 of our US counties are lacking maternity care right now, which is really a problem. And then we know that over half of these federally designated health shortages are actually in our rural communities. And so thinking about that and thinking about how do you continue the economic vitality or create economic vitality, those can't be at opposite ends of the spectrum. It doesn't work when they are. They have to be linked.
Yeah, there's so much in there. And you mentioned the report, you mentioned the Thrive Rural framework. If folks haven't taken time to dig into that, invite you to do that after our conversation.
Yeah.
Stay with us and check that out. We'll post those resources with the recording. But there's a lot in that Thrive Rural framework, and it really sets the stage for all of the pieces and elements that enable that thriving to occur. And you know how this specific topic of how do economic development and the health care, rural health, uh, work together, that touches on a lot of those topics. And you know, when we talk about rural hospitals as a prime example, I think that's an easy, or it seems like people could go, well, yeah, that makes sense. Hospitals are big employers. We know that they're important to the economy and they're obviously important to health. It seems relatively like that makes sense. So why, what's getting in the way of having those interconnected goals? So in the report, you talk about creating opportunities for same team understanding, and I like that framing of same team. So what's getting in the way of currently that local hospital or that local healthcare provider and the local or regional economic development or community development group not having a sense of shared goals that they can both point to and say, we're on the same team. What's getting in the way?
Well, I think unfortunately there are a couple things that get in the way. I'll start with the one that probably most people listening and looking at this will immediately come to, which is the funding, right? We need money to do all the things that we want to do, right, in our society. And one of the things is that funding doesn't actually necessitate working together a lot of times. It doesn't necessitate these fields, health and economic development or community development working together hand in glove a lot of times. So what you have is folks at either end of the spectrum have their own metrics of success that haven't actually been aligned across each other. And that creates a problem. And the funding mechanisms have helped to hinder the collaboration, really, in the separateness and in the separation, right? And so that's a huge issue. So you have all of the, whether it's federal government or state government, all these funding sources that reward you with the amount of people that you get employed or the amount of folks that go through this training program. But it's not looking at, okay, does this actually tie to what's happening within the larger community? How are we thinking about well-being as a total? It's not, they're separated. So that's an issue. And I think that also dovetails to the second piece that I'll talk about, which is really this idea of shared language. And there's not a shared language between health and community and economic development. The languages are separate, right? And that creates an issue for thinking about what is health, what is well-being look like. And it also doesn't help to build shared trust among the actors that are working in either of these fields. And so that itself is a problem. We know that in rural communities and our rural regions, trust is critically important to getting things done, to the success of anything. And we know that trust is built at the speed of relationships more so than anything, right? It doesn't happen overnight. And so when folks have been working in their silos, working in opposite ends of the spectrum for a long time, it's really hard to then just bring everybody together and say, okay, make this happen. It doesn't, that's not how it works. And the fact that our funding systems aren't incentivizing people for collaboration and really for working together, not just for one green opportunity, for instance, but really working together for the betterment of the community as a whole, that creates a bit of a issue. And that is one of the pieces that leads to folks not feeling like they're on the shared team, the same team, and they don't have the same shared goals around what makes this successful and what is success for whatever it is.
Yeah, we're talking about principle one. You've got three principles that you've laid out in this report. Principle one, recognize interconnected goals. I heard a few things in there that can be challenges, but if we can flip those challenges, they can be strengths. Shared language and shared measures of success
Mhm.
and trust. And
Yeah.
I want to talk quite a bit about trust because I think it's so important. But first, I want to just sit a little bit on shared measurements. So we talk about shared measurements or definitions of success. Uh, One of the challenges uh, can be that, as you pointed out, the funding itself uh, defines what measures of success they're looking for, and those are on two parallel,
Yep.
non collaborating tracks. But even outside of a distinct grant opportunity or funding opportunity, is there a way that you've seen be successful for community members? If you were talking to a community leader, whether it's a health coalition or economic development director, that's trying to say, here's what we can look to that we can all look at and say, this is how we know we're being successful? Or are there ways of framing that you found successful that aren't aren't don't feel like they're entirely in one side of this balance, but can be shared? Have you found anything that is a good way to bring people together?
So I think one of the ways in which that can happen. So previously, I worked at a community foundation. So and I led some workforce investments and economic development investments there, right? And as a just a bit of a small example, um, at this time, people were not thinking about workforce development as a part of economic development, which I think is crazy, right? It was crazy to me then, but I think now tides have turned and people really understand that, okay, to have a thriving, community, you have to have workforce as a part of that if you're going to have a thriving economy, right? But I think part of that was on the funder or funders coming together, and in our instance, the community foundation coming together with non-traditional partners. And I say that with air quotes, right? Bringing folks together from the community college system, from community health center, as well as us and an employer to really form a partnership. And what I would say is that's an example of how you bring non-traditional people to the table to make something happen, right? And I think the same can be done, and funders can have the same impact now on bringing folks together through collaboration, right, from non-traditional partners. So when you're giving a grant, thinking about economic development within a community or region, how are you utilizing the partners that are on the ground that are already doing that work? And so what we advocate for is really this approach of thinking about the hubs within your community. And those hubs can sometimes be community foundations, they can be community action agencies, they can be um, an economic development district. But the real key to the hub is that they break silos and they work across silos. And so this idea of bringing these non-traditional partners together, it could be an economic development district for the region, right? How are they working with their local community-based organizations? Those community-based organizations have partnerships with community, with local, whatever the health entity is. How are you bringing all those folks together to have a conversation? And what we've seen is that in communities, in these hubs, that are doing that type of work, it can be transformative for the region. And so that's the examples that we see on the ground and how that's working, whether it's communities in Minnesota, whether that we've worked with, right? Or whether it is communities in the Black Belt of Alabama. Those are the ways in which they're doing it differently and breaking those silos and making sure that everyone is at the table. And really goes back to the core point of the framework, or one of the framework building blocks is designing for everyone to thrive at the outset. Really, how are you designing with everyone in mind within your community? And if you do that, then health is a part of that because you're thinking about the well-being of everyone at the community. And that means that you have to have more than just the economic development folks at the table, as important as they are, and more than just the health folks at the table, as important as they are. You're really thinking holistically.
I see you're getting a couple hearts. Appreciate
Oh,
people's reactions. So that's resonating with people. A friendly reminder, if you have comments, reactions, feel free to put those in chat. If you got questions, we can pull some of those questions in for Bonita. Use the Q&A feature there, and we'll bring those into the conversation. So designing so that all people and can thrive. And something I kept hearing is this ability and this willingness to recognize that things are interconnected, that they're that no one and that thriving requires that we think about multiple groups and multiple people at the same time. We can't sort of think in silos and buckets. We have to, from the onset, sort of have that framing of this is an interconnected, dynamic community where we can't break off one piece and just sort of say that's all we're going to think about. That's challenging. It's easier to just say, well, my job is to just think about this. It takes time and work and patience to think about it in this holistic way. And it also requires something you mentioned earlier that I want to go back to because I think it's so crucially important. It requires building trust. And we like to say that in our work that collaborative efforts move at the speed of trust. And you've taken that one step further. And then you say, so how what influences how trust is developed? And you say trust is built at the speed of relationships. So tell me more about that relationships piece, especially when we're thinking about bringing in or involving people that are outside of the community, whether that's
Yeah.
state agency, federal agency, regional
Yep.
organization that aren't on the ground. How do we build that trust between locals and those groups?
So, I would say that, as you noted, trust is built at the speed of relationships. That's what we firmly believe. That's what I firmly believe. And we know that relationship building is hard, right? It is not, you just meet someone and you're like, oh, I trust you immediately. That's not how it works. What really works, what really is how it works is you continuing to show up day in, day in, day out. You doing what you say you're going to do. So I have a toddler, and we were literally having this conversation with my toddler yesterday around, you do what you say you're going to do. That's important. And that's the same in any relationship, right? Whether you're talking to a toddler or an adult. But that's how things get done. Is really you show up, you say, you do what you say you're going to do, and you own when something doesn't happen the way it was anticipated to happen. And I think one thing that's required is that everyone give each other grace. Um, and we're doing hard work, right? This work, as you know, that Wyatt, isn't easy work. To work across silos is not easy. But if you go slowly, you build that trust, you work within community. Most communities, most people are going to give you a little bit of grace when it doesn't go as it was originally anticipated or as everyone originally expected it to. But the idea that you're actually bought in is critically important. One of the things that we hear when we talk to folks is, um, we recognize that we don't live, myself or Chris, my co-executive director, we don't live in every rural community in every region. So we realize that, we don't know what's happening in every community across the country, but the people that do live there do know what's happening, and that there has to be a real level of trust around the understanding that they know what's happening within their community. What we think of at CSG is we're sharing resources and tools and stories of what we know is happening across communities, and communities can use that as they see fit. But I think this idea of trust is not something that comes lightly. It's not something that comes quickly, but it really is a, a conscious effort of showing up, of staying the course, and of doing the hard work. And I firmly believe that you own up to when something doesn't happen the way you wanted it to. And you celebrate when the things go better than you expected them to. But the fact of the matter is, you have to be there. You have to be present to either do the, oh, I'm sorry that didn't happen the right way, or to, yay, we did this and it worked exceedingly well. But you have to show up. You have to be there.
Yeah, I what a great summary here. Show up, stay the course, do the hard work. And I love that it starts with showing up because it seems obvious, but we can take it for granted that it it means a lot to literally show up, uh, like mentally, physically, and say, your community is worth me giving the time to. And without saying it directly, showing up is honoring that they're worth that time. You're
Absolutely.
showing up and giving them that time, and I think that can be really meaningful. And I'm being reminded in chat from Dr. Moore, don't forget, do what you say you're going to do. Yes,
Yep.
that's a big piece. And I saw a chat from Erica Burrows Girardi, a friend at County Health Rankings and Roadmaps. She notes that this work requires that organizational leadership and funders understand that building trust takes time
Yep.
and non-traditional engagement spaces. So she's pointing us back to that
100%.
that piece of funders or policymakers or program decision makers have to recognize that it takes time and be
Takes
willing
time.
to enable that time.
Absolutely. I couldn't agree more. I think one of the things that can be so challenging is when you have someone that wants to invest in some way, shape, or form within a community or region. They don't understand the community or region. They're not working with local folks that actually understand the community or region, but they want to give money, and then they're shocked when they don't get the results that they want. That can be very frustrating, and I think it's frustrating for the people that receive the support, whether it's financial or otherwise, right? Because it is episodic at best. It is not a real sustained commitment to the people and the place. And I think that's really frustrating. And that's not the way that it's supposed to be, right? In any way, shape, or form. And I think we also understand that it is, it can be challenging. Regional can be a bad word in some places. And I think we as CSG try to recognize that. While we also really want communities to think about the shared benefit and the shared assets that they have across a region. But we understand that regionality may not be the thing that people want to do. They don't want to work across regions because they've had bad experiences in the past, right? And there hasn't been a trust that's built across the regions over time. It's been this example of, oh well, the plant came to your community, it didn't come to mine, and so it's a zero sum. You got everything and I got nothing. And I think that frame of mind we have to work to shift it, because what we know is that a lot of times people are traveling across a county line to go to work. They're traveling across a county line to get their groceries, right? And so, really thinking about that region as a whole and the benefits that flow to that region. And I think, employers haven't done a good job. It's been, pitting each community against each other. What can you do versus, but really thinking about a regional context is important. And then one final thing that I'll say, Wyatt, because you brought it up, is this idea of measurement. And we did a whole piece also that's on our website, really around thinking about measuring rural development progress and success. And what we know is that measuring rural development progress and success is different than measuring urban development progress and success. And this was the first Thrive Rural Action Learning Exchange that we did, really bringing, I think we brought like 50 folks together from across the country to really think about this issue of measurement. And it really was during the time of thinking about the funding that was coming through the federal government at the time to a lot of rural communities and regions, and really wanting to shape how the government and philanthropy was thinking about, well, how are you going to measure the success of these initiatives, all this money that's flowing out? And understanding that typically what we do or what we have done in the past is take urban measurements and then just supplant them to our rural communities and say, okay, well, we're going to measure by volume, right? So, like, the most people that you can train means that you're the most successful, or the most jobs that you can get means that you're the most successful, without measuring, for example, percentage change, right? And we know, because we know that if you're measuring New York City against any community in any rural community, right? You're never going to have the same volume. it's never going to work, right? And so how do you think about that percent change in a real way? Because if you're doing some work in a small town and you get, you know, five people um new jobs, or you have a coffee shop that's opened in a main street, that has exponential consequences, right, and spillovers. And sometimes that's not calibrated in the right way. And so again, there's a measurement report that thinks about all these ways in which you measure rural development progress and success, including thinking about momentum, including thinking about percentage change, including thinking about decreases in divides around race, place, and class, right? How are you thinking about all of these pieces? And how are you thinking about how people are coming together and collaborating in a real way versus just a numbers game?
Yeah. And it that that difference in measurement and being thoughtful about that, I think about, my hometown. I'm from Western Kansas, a town called Nest City. My graduating class in high school was 31 people. And we were a big class.
Yeah,
We were a big class. And so if you were doing a high school program for seniors and you got 30 people to show up,
yep,
amazing, raging success.
yep,
You get 30 people to show up at a high school in New York City, you probably didn't do so great. But
yep,
so like being able to add that context, whether we are local rural communities talking about our work, or we're funders or partners making the requirements or setting the expectations, really being cognizant of context
yes.
and the local realities is really meaningful to that work. I want to uh, see a pull in a question we got
Okay.
thinking about our rural communities and that unique context and what they look like, what how they're changing, who is there. We know that our rural communities are diverse and dynamic, and rural Western Kansas looks different than rural
Mhm.
Mississippi looks different than rural Vermont.
Yeah.
But we also know that there are some shared challenges, opportunities, and one of those is a growing population of older adults, those
Yes.
that are 65 plus. And Emma asked in chat, as your team works on economic development, do you have any strategies, examples, or recommendations for how older adults are being actively considered instead of overlooked?
Mhm. That's a great question. Um, and yes, you're absolutely right. What we're seeing is that there are some areas, what the data is showing is that there are some rural communities that are losing population, some rural communities are gaining population, right? But generally, what we're seeing is that the rural population is aging, right? And so how are we thinking about, and what part of that is also what we're seeing is that some of the older population are moving into rural communities and regions for retirement, right?
Mhm.
And we're also seeing some folks that are moving to communities, rural communities and regions that are escaping either coasts, or they're moving for environmental concerns or reasons, right? And so we have been taking a look at a number of those different factors. One piece that I'll mention is that we did a piece specifically focused on equitable outdoor recreation, thinking about communities that have become these outdoor recreation spots. And some of those are communities that some might think of as bedroom communities, right? That folks have moved to, and that's also a piece of our website on our website. Excuse me. I think that other piece around how are we thinking about older Americans and their care, and particularly in these rural communities, gets to this question, the whole point of why we're here, right? Why end up thinking about how is health intertwined with that?
Mhm.
And this idea of how are people able to age in place? And if you don't have viable health systems, that becomes a lot harder for folks to be able to age in place. And what I mean by that is, I'm not just talking about hospitals, because what we know is that it's not just hospitals in rural communities, right? It's the community health centers, right? It's community healthcare workers. So it's not just about a hospital, but what is the system of care or the structure of care that is within our rural communities, and how are we making sure that there's viable care so that there's total well-being for everyone, and particularly for older Americans that are either aging in place or moving to some of these communities. One of the pieces that I think is also important to name here is this idea of generational wealth transfer. And what we know is that a lot of wealth transfer is happening through the sale of businesses. And how are we making sure to keep some of that wealth local, so that folks, and that goes to this point of around younger people, have the ability to stay within their family business, not sell the family business, but how is that wealth transferred, and without children moving away, right? And so there are a number of ways in which we're thinking about this idea of how are older people able to stay in their rural communities and still thrive.
I hear we're responding to a question about older adults and think about how they're involved and support in this, and bring up youth. And I think it's such a great example of how, these things are interconnected, and we can think about we that's another example where we can't think about our older population as a silo or in a silo. We have to think about the broader systems and structures, and that connects back all the way to youth. And how do they see their community? What opportunities do they have to get a solid education, to advance in their career, and where does their community fit into that image? And this is all around this idea of principle two in your report: align systems and structures. So align systems and structures, that requires that we recognize that there are interconnected goals and that we build trust and relationship, and then we do the work of trying to find ways to align those systems and structures. You've mentioned several times the third principle in different ways, but I want to really zero in on that. The third principle is follow community leadership. Follow community leadership. And you, at the very beginning, you said the phrase, or the two words, local assets. And that's a big piece of how you think about community leaderships. And in the report, a quote that stood out to me is said, keeping people at the center and communities in the lead. Tell
Yeah.
me about that framing. People at the center, communities in the lead.
Yeah, I mean, what I would say is it really goes back to how we think about the work that TSG has always done around thinking about the assets, right? And a lot of times when folks think about assets or capitals, they only think about the financial, but there's so much more to that, right? The human potential of people, right? The intellectual assets that we all have, the social fabric that binds folks together, that binds communities together, is really important. And the framework really is the ultimate outcome. Why you started talking about it at the very beginning is really communities and native nations are healthy places where each and every person, and that language was very intentional. It was, we went, practitioners and researchers who helped develop this really went back and forth as, should we say everyone? Does everyone feel like they're included in everyone, or is it each and every person? And that's why we really said each and every person belongs, can live with dignity and thrive. And so it has to be core. The framework itself has multiple building blocks around designing for everyone to thrive, welcoming everyone into the community, right? All of those pieces are important, and they are inseparable for thinking about a thriving community. And so you have to design with people at the center, because without it, then what happens is you build these structures that don't think about people, that don't think about people with disabilities, that don't think about older Americans, that don't think about um, the fundamental pieces that make us human, right? Is thinking about how can we work together? How are we building something together that works for each and every person? no matter where they are, no matter what race they are, what ethnicity they are. How are we working to make sure that they can get to what thriving is for them? And so that really is a core of how we think about the work.
It makes me think about another connected uh, quote I saw in the report talking about the significance of place. And people live in a place, and especially
Yes,
in rural communities, that place is meaningful. And the line that I highlighted, all plans and processes should center and serve the place rather than the reverse. And I think you could almost swap in place with people. So this is designed to support and serve the people, not the initiative or
yeah,
the plan itself. And I think that framing of centering people and place is a really good starting point. Something that I think can be a part of that can be challenging, particularly from the outside coming in, is being willing to and creating the space to recognize the unique history and story of a place that shapes how people approach working together or how they
absolutely,
approach certain types of initiatives. And
absolutely.
and each community has that unique history. So how do you think about whether you're a funder or a partner or a community itself, creating that space to recognize the unique history that's oftentimes challenging?
Yeah. I think so. That's such a great point, Wyatt. A couple points on that. One is an example from some work that CSG was engaged with some community partners, and particularly thinking about some partners that we were working with in the state of Michigan. And as a part of that process, and the project was really thinking about communities that have solely relied on one form of an economy, right? And so what happens, it was really trying to think about what happens when that economy is no longer present or it's dwindling or it's, how does a community work to pivot and use the assets that it has, right? And as a part of this learning, they brought together for the first convening, brought together everybody in a room. And there was really thinking through a process that engaged thinking through the history of the community and folks sharing what their history was for them. And it wasn't about one person saying, well, that didn't actually happen. This is how it happened. It really was about everyone being able to own what was their history according to them of this place that they all lived in. And for those that weren't born there, they chose to make it their home and they had been there for a while. What was the history of that place? And so that goes to that point of acknowledging the history of a place. And institutions have history. There's an institutional history as well. So there are some places. Um, when I worked at the community foundation, there are some regions that it's like, wait, we had a bad experience with you. So, that institutional history outlived what happened with me showing up in a place. And so it's important to recognize both the institutional history that organization may have and the history of that place, right? And coming to really terms with that and acknowledging that one of the foundational element of our Thrive Rural framework is really dismantling race, place, and classism. And part of that is understanding that places, as you said, have a history. And sometimes that history has not been kind. But if you don't acknowledge that, you won't be able to get to the fact of moving forward, to acknowledge what may have not gone wrong in the past, actions that were taken intentionally to make sure that some people didn't succeed in the past or didn't have opportunities in the past. But if you don't know your history, you are bound to repeat the history. And that's not me. Obviously, a person that was far smarter and wiser than me said that. But if you do not acknowledge it and understand it, then you're going to keep repeating the same thing. And so understanding the history of the place that you're in is critically important. And the final piece that I'll say on this is really tied with understanding your place and knowing the place is understanding the people that make up that place, right? And people themselves understand their history, and they hold a lot of knowledge and power around that place. And so, one of the pieces around when you're thinking about working in any community is understanding who are the folks that are really critical within the community to understand and to know and get to know, right? Because they have linkages to so many other people within the community, and they themselves kind of act as like individual hubs, right? You know, if you talk to the folks at the barbershop, right, or the salon, right, like who, where are you going to get your hair cut? There are a lot of conversations that are happening wherever you are that are going, where you're going to get your hair cut, right? Or who's the person that's out on Main Street, that's sitting out on Main Street all the time, right? Like they know where everybody's going, you know, Wyatt shows up every Friday to get, you know, his groceries right here, right? You know, so understanding that context is also important.
And those people oftentimes or don't always have titles and
Oh,
have
exactly.
roles. And
Oh,
it's
no,
being open to that informal leadership, as Dr. Moore just put in Q&A,
absolutely.
is really important.
And they don't have jobs. They're not paid by anybody a lot of times to do, like, that is just they are of, and they're fabric of the community. It's not about, they don't have, like you said, a title or a formal job. They're, that's just they are of that place.
And when we think about that guiding question we had today about bridging health and economic development, those folks that may not have a title but have a deep understanding of place, a deep understanding of community, and can bring that to those conversations. They can be really valuable for making those bridging those two sectors. And I one other thought that I had when you were talking about unique history, and I think this is an example that's directly tied to this opportunity and challenge of bridging rural health and economic development. And that's the unique story of what healthcare looks like in a community. And you mentioned rural hospital closures. We know there's new models. We know that there's uh, shifts in who leads hospitals and who provides healthcare. All of that is part of the story, and creating a space to understand the different experiences in a community going through that uh, is really important to then working together on ways to move forward, uh, to create and sustain that um, healthcare resource. I we're coming up here, and time goes really quickly when having a great conversation. I wanna talk about, come back to this idea of building on local assets and resources, and ask you to put your hat back on for that community foundation work. You know, we know that as much as we are trying to, and it's crucially important to recognize those local assets and resources, there's still a role for those external grant opportunities, that system-wide, that statewide, federal support, regional support. And that oftentimes presents itself through grants. And we know right now in our country and our states and our communities, there's a lot of debates and discussions and shifts in funding happening right now, which can make this topic particularly meaningful and challenging for folks. But when you think about the role of a community foundation in that environment moving forward, how do you balance wanting to bring in external support and recognize local assets? And what advice would you give to your former self or to those that are sitting in the audience that are in a position of distributing resources or providing technical assistance or making those grants?
Yeah. So I'll start with the first question, I think. Really about this idea of, you know, I think that I am a fan truly of community foundations. I believe that they have really the potential to do so much good in our regions. I think that, and they have been for a long time really an untapped resource for national philanthropy, really. I think that community foundations can do their work so well because a lot of them, really have trusted relationships amongst their community, or they should be working towards that, right? They have the ability to take risk, as all philanthropy, in my opinion, has the ability to take risks and to be innovative and to work across silos. And I truly believe that foundations and community foundations in particular have the role of using their assets, all of their assets, including their financial assets, but also their voice, and really to influence innovation, to influence change. And so I think that is a critical role that foundations and community foundations can play. So it's not just the assets, the financial assets, but really utilizing their voice. And when I worked at a community foundation, that was one of the things that we saw happen over the course of years, is not just solely being a foundation that really was in the role of taking donor advised, creating donor advised funds, taking money from individuals, helping them to support the foundations that they cared about, but really taking an integral role in utilizing assets for the community and to make the community a better, more thriving region. So that's really the role that I think community foundations play. And I think more community foundations, there are a number that are already doing this. And we see that in our hubs report. And we're going to put out a report in another month, which is really an update really on the hubs report. And there are a number of community foundations that will be cited in there that are doing this work, that are acting as hubs within their regions, right? More should be doing that work and really taking the risk and working across the region and helping to make their communities more vibrant places. If I was going back and going back in time, or if I was talking to my younger self, and to all my, former foundation colleagues, I would say, make it simple. One of the things that I was most proud of when I worked at the foundation was the idea that I worked with another foundation partner, another program officer, to design a program that was really focused not on health, not on workforce, but that was focused on criminal justice. And we really put an intentional focus on making an application that was as easy as possible for the folks for our grantees or potential grantees to fill out, and had as easy of a process for them to do a check-in with us, and as easy of a process for them to actually do their final closeout report. And that was one of the proudest things that I've ever done in my career, because it made everything so simple and it made it easy, and it got the resources out in the quickest possible time to the folks that needed it the most. And what we called it was a surge grant making process, because it was very quick, it was responsive. And what we did was we actually got them all in a room, said, we're going to write this all up. So you tell us what you're going to do. We took on the grunt work of typing it all up and putting it in the forms. And then they obviously had to sign off on it. Like, is this what you actually said? Just want to make sure this is what this is what success is going to look like for us at the end of this. And then at the end of the grant, we gathered everybody back together. Again, we took on the grunt work of typing it up. We just asked them to tell us what happened. Tell us the stories. Tell us how this actually changed. We will type it all up. Again, we checked for understanding just to make sure this is what you said. This is actually what happened. And that was it. And that I understand that everything can't be like that, but we can take lessons from that in our everyday grant making to make it easier for the folks that are on the ground. What we know about our rural communities and regions also is that there is not every community doesn't have a grant writer to do that work. Most communities, most of our regions, one person is doing the grant writing that also has 2 or 3 other jobs. That is not their main job. They're doing this because they care about their region, they care about their community, and they know they need resources to do the work. They have the commitment They have this, but they're lacking maybe the skills of a grant writer, and they're lacking the resources to be able to do the work. And so, how can we make it as easy as possible for our communities? The other piece that I would say is that it is really important to acknowledge the power structures and the power dynamics of a funder coming into a place. Whether it is a community foundation as a funder, they're closer to the ground, so they have a better chance of really owning and understanding those power structures. But a national funder really does not understand what is happening in the community unless they are actually of that community and from that community. And so acknowledging the power dynamic and walking up, acknowledging it, and then choosing to walk alongside or behind your community versus you dictating what should happen is something that I think I would always say to any person that is interested in working in the community, whether it is whether they are funding that community or not. And then the final thing that I'll say is that our plea, one of the things that we really try to push is that national philanthropy make investments in hubs, make investments in community foundations that are hubs, that know the community, that are of the community, that have the trust of the community. Because it is a better investment to invest in folks that have been working in that region than to try to start a program all on your own when you don't know the community of that community.
So many great insights and points in there. I like the phrase alongside or behind a community. That sounds a lot like principle three. Follow community leadership, not
Yeah.
ask them to follow you where you want to go. And that requires taking the time to recognize that there are existing assets,
Yes.
that there are existing people and leaders and hubs that we can support or build upon. And the other thing that I hear in this, sort of going back to some earlier conversation, that great example of how you went about grant making with those community groups, that sounded like a room where there was a lot of trust.
Yeah.
And it's the sort of approach that only probably works when the funder trusts that the people showing up are committed, they have skills, they have the will and the desire to do it with the right support, and it's them trusting you to capture
Absolutely.
their idea and be a good partner. And that
Yes.
takes time, and that takes patience and commitment, and it takes openness on both sides to be willing to build that trust together, and not have it be transactional. And I think
Absolutely.
sort of putting a bow on this as I have my last sip of coffee here. That trust cuts across all of the principles that we talked about. So our key question today was thinking about how do we bridge health and economic development. But a lot of the conversation talked about how do we bridge any sort of divide and how do we break down silos. And uh, goes back to recognizing interconnected goals, seeing how we are on the same team, building trust, and recognizing those existing assets, and then owning and being honest with the stories and the history of place, and then being willing to move forward together from that. So many great insights and things that I'm excited to keep thinking about and reading. And you mentioned several resources. We will share this recording on our website along with the resources that you mentioned. Before we hop off, I want to acknowledge I know there are a couple questions I didn't get to. Thank you for adding those in. And I want to invite you all to come back next month. We have another great conversation in store. That's on July 30th. It'll be with Tony Pippa, who is a senior fellow at the Center for Sustainable Development at the Brookings Institution. Uh, It'll be another wonderful conversation. So if you got something out of today, and I'm sure you did, please come back next month. And with that, Bonita, thank you so much for your insights, your time, your stories. I had a great time. Really enjoyed it.
Ditto. It was a pleasure. Thank you for inviting us and looking forward to the next conversation. Tony is a friend of CSG, so I'm sure it'll be a great conversation as well. Thank you, Wyatt.
Some thank you all. Take care.